So we're back. Going to give you two really quick little things you can do for that IT band hip mobility, maybe a little bit of strength mobility combo here. If you've got some hip issues, if you're struggling with actually some knee pain down here where that IT band crosses that knee, these are two great exercises to do for just general everyday IT band hip health. But also if you're a runner or something like that you're struggling with IT band pain or weakness, this is a great supplement, or maybe even a pre-run type of functional warm-up that you can do. Two simple things real quick. So we're going to stand in just a normal kind of gait pattern. All I'm going to do, I'm going to cross my hands across my shoulders so that I make sure that I get the rotation at the hips and at the trunk that I want to get, and then I'm going to work on this left leg. It's going to stay planted, toes are going to stay straight ahead. All I'm going to do is just rotate around that hip, so we're getting some hip internal, external rotation, but you can really feel that stretch on that IT band as you get that rotation. So we're just going to open up, and then I'm just opening up as far as I can. Foot's going straight ahead, knees straight ahead. Then I'm going to come back, and then I'm going to rotate in the opposite direction. So I'm going to turn those shoulders. Foot is still driving straight ahead, so in that position you can see the foot still straight ahead, knees straight ahead, standing tall, I'm not really bending or flexing anywhere, and I'm just getting that rotation right there. Then I come back and open up. So I'm just holding for a few seconds right there, and we're getting that rotation, nice strong rotation. So as we do that, we're going to do quite a few repetitions on both sides. Do about 10, 12, 15 reps on both sides, really causing that hip, which is fixed to the floor. You're really getting that internal, external rotation at the hip. Then we come down into almost what looks like maybe a little pillar oblique or a little oblique type of work. But what we're going to do is we're going to get some trunk flexion in here and some hip extension as well. So we'll get some flexion, extension at the hip, really working on that IT band that's on the downside. So when I'm in that position, it looks like a normal little setup for maybe like a little hip dip that you would see. I'm going to pick up that top leg, and then in this position, as I take my leg back, I'm going to flex at the hip here and bring forward and back and forward. So I'm also going to go forward as well, so we get some flexion in that trunk. Boom, hip drive there. So I'm getting some flexion at the hip, really driving home that hip extension. So there, hip comes back, come forward, and here, hip comes forward. So I'm getting the flexion, as you can see at the hip. I'll turn so you can see it. So I'm getting the little trunk flexion here, hips coming forward, drive home as I extend that hip and extend. Really get that extension there. Boom, coming down. Hip is off the floor. It's hard to see. The hip is off the floor as I come forward with the top leg, and then I drive home that hip extension on the bottom as I extend on the top. Boom, to there, and extend. So try those two. You will really feel that glute and that IT band kind of lining up there in that hip as I flex the trunk, leg comes forward, and extend. And again, you can get some opposite in there if you really want to work on that glute on the posterior side. As you do it, you can flex forward and extend. Try that, see what you think. Little hip work, IT band work, strength, mobility. You'll light up that hip as you do the work, and you'll feel it.